Chronic inflammation is the one condition quietly destroying millions of people, and most of them don't even know it's happening until the damage is already done. Heart disease, diabetes, arthritis, gut issues, brain fog, autoimmune disease. Almost all of them have one thing in common: inflammation out of control. I'm Suburban Prepper, Desert Storm and Afghanistan combat veteran, former 160th SOAR medic, a nurse practitioner, and a graduate of the George Washington University CAM program in Integrative and Alternative Medicine. I've treated inflammation from every angle: conventional medicine, battlefield medicine, and integrative alternative medicine. And today I'm going to show you how to understand inflammation from both worlds, so you can take control of your health before inflammation takes control of you. Stay with me to the end, and you'll learn how inflammation starts, how to test for it, the symptoms you shouldn't ignore, the treatments that work, the diet and lifestyle upgrades that can change everything, and the Ayurvedic and herbal remedies that have been used for thousands of years to restore balance. Inflammation isn't the enemy. It's your body's alarm system. From a Western medical perspective, inflammation is your immune system responding to injury, infection, toxins, stress, or metabolic imbalance. But from an alternative medicine perspective, inflammation is deeper. Ayurveda calls inflammation an imbalance of pitta, the fire element, combined with a buildup of ama, or metabolic waste. Traditional Chinese medicine views inflammation as heat, stagnation, or blocked qi. Both systems agree. When your body can no longer clear heat, toxins, or waste, you develop chronic inflammation. And when inflammation becomes chronic, it slowly damages blood vessels, joints, nerves, hormones, the gut lining, and even your brain. But how do you actually know if inflammation is happening inside your body? What are the real signs and symptoms of inflammation? The ones most people miss. Inflammation doesn't start with pain. It starts with subtle changes in your energy, digestion, and mood. Fatigue, that makes no sense. Brain fog or poor focus. Joint stiffness, especially in the morning. Unexplained muscle aches. Digestive issues like bloating, constipation, diarrhea, or acid reflux. Skin problems like rashes, eczema, acne, or redness. Headaches or migraines. Weight gain around the midsection. High blood pressure. Mood swings or irritability. Poor sleep. Recurring infections. Slow recovery after exercise. Your body is warning you long before lab results change, but symptoms aren't the whole story. If symptoms can be misleading, what lab tests reveal the truth about inflammation inside your body? Here are the labs every person concerned about inflammation should know. CRP, C-reactive protein, the big one, the inflammation marker tied to heart disease. ESR, the sedimentation rate, another inflammation marker. A CBC, which looks at white blood cells and signs of infection or immune activation. An ANA, which screens for autoimmune disorders driven by inflammation. Vitamin D, low levels increase inflammation dramatically. Homocysteine, one of the biggest cardiovascular inflammation markers. A full lipid panel, because inflammation impacts cholesterol, triglycerides, LDL, and HDL, and A1C, because blood sugar and inflammation go hand in hand. But here's the problem. Labs tell you what is happening, but they don't tell you why. And labs don't fix inflammation. So if labs reveal inflammation, how do you actually treat it? If you want more videos on integrative medicine, functional labs, and healing from the inside out, hit subscribe right now. From a medical perspective, inflammation can be treated with NSAIDs like ibuprofen and naproxen, helpful for pain but harmful long-term. Steroids like prednisone, extremely powerful but dangerous if used too often. DMARDs for autoimmune diseases, strong immune suppressants, antibiotics if inflammation comes from infection, blood sugar control, because high glucose pours gasoline on inflammation, and weight loss, because fat cells create inflammatory chemicals all day long. These treatments help, but they are not enough. What if you could reduce inflammation using food, lifestyle, and habits, and do it naturally? Food can be medicine or inflammation. Eating omega-3 rich foods like salmon, walnuts, and flaxseed reduces inflammatory cytokines. Bright, colorful vegetables. The antioxidants literally put out inflammation like water on fire. Leafy greens like spinach and kale. Lowering sugar can drop inflammation in days. Fiber improves your microbiome, and your microbiome controls inflammation more than almost anything. Hydration flushes inflammatory waste. Sleep is essential. Poor sleep increases inflammation by 20-30%. Stress is one of the biggest drivers of inflammation. Even walking after meals reduces blood sugar spikes, which reduces inflammation. And losing even 5% of your body weight lowers inflammation significantly. But ancient systems understood inflammation thousands of years ago. What did Ayurveda teach about inflammation long before medical labs existed? Ayurveda sees inflammation as an overheated, overstimulated body, a pitta imbalance, combined with ama, undigested toxic waste that clogs your system. To treat this, Ayurveda uses herbs and remedies that cool the body, clean the gut, and calm the immune system. Turmeric with black pepper. Curcumin is one of the strongest natural anti-inflammatory compounds in the world. Ginger supports digestion and reduces inflammatory signals. Ashwagandha calms stress hormones that drive inflammation. Triphala cleans the gut and removes ama. Boswellia, also known as frankincense, powerful, anti-inflammatory, comparable to some NSAIDs without damaging the stomach. Tulsi, or holy basil, balances the immune system and reduces stress. Even simple cumin, coriander, and fennel tea can cool inflammation and improve digestion. But what happens when inflammation is no longer just a nuisance, but a warning sign? Here are your quick facts. Inflammation is a root cause of most chronic diseases. High blood sugar creates inflammation. Poor sleep triggers inflammation instantly. Your gut bacteria control inflammation. Stress hormones increase inflammation. Turmeric works better when combined with black pepper. Omega-3 reduces inflammatory cytokines. Hydration clears inflammatory waste. Truth or false? All inflammation is bad. False. Acute inflammation saves your life. Truth or false? Sugar fuels inflammation. True. Truth or false? You can reduce inflammation without medication. True. Truth or false? Stress can cause inflammation even if your diet is perfect. True. Drop a motivational comment. I'm healing my body from the inside out. Chill. Seek medical care. If inflammation comes with unexplained weight loss, fever, night sweats, severe joint swelling, chest pain, shortness of breath, severe abdominal pain, rashes with joint pain, or neurological symptoms. Inflammation is not a disease. It's communication. Your body is telling you something. And when you understand inflammation from both a medical and an alternative perspective, you stop guessing and you start healing. This is healing. This is resilience. This is alternative medicine.